So I would like to call Dr. Lakshmi, who's a co-instructor. So she's a dynamic skin surgeon. She will explain about the our improving our strabismus skills with a modeling.
So, good afternoon. The last session, all will be planning to leave, but still, we come forth with an interesting idea of how to hone your strabismus skills with a model eye and a completely DIY, do it yourself model at a very low cost. So, commercially available models are very costly. The commercially available models, especially for the use of strabismus surgery techniques. So, the approximate cost is 50 euros, and do it yourself models have been described and published. And we have used locally available material, no material to be bought exclusively from any other vendors. So these are the equipments that we need for a cost-effective wet lab. Um, so this is a small makeup sponge that we have. Sorry. So this is a makeup sponge, felt paper, then plastic covers which we can avail from any of our purchases, a cotton cloth, suturing equipments, or a simple needle and thread just to attach it, and the surgery instruments that we usually carry. A holder, you can, I have just used a plastic, old plastic box with a hole to hold the eye, but you can use any sort of instrument, you can use a cardboard box like Raju sir had told. We had used that in our wet lab when we had conducted the wet lab. You can use this also. So this is how you make it. It's a makeup sponge costing less than 150 rupees or so. A central area is marked there, which represents the cornea. We can mark the muscle insertions with a scale. And after marking that, cut out few felt paper strips for the muscle, cut it out to the required size. This also costs very less than 50 rupees or so. And this can be attached to the desired muscle insertion site with a simple needle and thread. I like sewing, so maybe I did the sewing technique. You can also use a glue gun for the same. That will also give you the same result. So here are all the recti and the obliques, and we can cut that extra thing. So these are plastic sheet and cotton cloth. We'll cut a rectangular model of that. And the central area, we have just cut a small area to represent the cornea. So I've used 2 sheets just for getting the feel of the tenons and the conjunctiva. So this, keep one above the other and simply wrap it around our eyeball sponge. This is the first layer of plastic which represents the tenons. The corneal part is just left behind. And over that, we just wrap it around with a cotton cloth and secure it with a rubber band. So this is how we make our model eye. Now, to give it a little bit more cosmetic appeal, you can attach your googly eye or draw an eye there. I've used the symbol holder. A cardboard box with a cut can also be done. So here we have made a limbal incision, conjunctival flap over the muscle area. And then the tenons, the feel of the tenons also can be got with scissors. So this it gives a sufficiently similar feel of tenons, even though not exactly. And we can hook the muscle just like we hook how to insert the hook and how to pass the sutures. So this is the first pass which is a partial thickness pass with a 4-0 black silk suture, and the second suture is also passed. We can cut the muscle at the insertion. And muscle recession or resection can be practiced. We can pass the sutures to the desired site. So this is how we go about doing a model eye and squint surgery. So thank you for your patient listening.
Thank you, Dr. Lakshmi, for excellent demo with a nice video.